Good afternoon, everyone.
Good
Good
afternoon, sir.
afternoon.
Today we are going to discuss biomechanics of torso metatarsal joint. So the other name for tarso metatarsal joint is Lisfranc joint. So in amputation, you might have studied Lisfranc amputation. What is Lisfranc amputation? Amputation at the level of tarso-metatarsal joint. Amputation at the level of tarso-metatarsal joint is called as Lisfranc joint. Sorry, Lisfranc amputation. So that is why other name for this joint is Lisfranc joint. There are totally five tarso-metatarsal joints. Clear? Image. So this tarso-metatarsal joint, it separates the midfoot from forefoot. You know there are hindfoot, midfoot, and forefoot. Clear? There are three parts are there in the foot. So this joint it separates midfoot from forefoot. 1 second. Mansi Parmar,
Yes, sir. Yes, sir.
mute your audio is. So there are five tarso-metatarsal joints and midfoot and forefoot. So what is midfoot and forefoot? This is hindfoot, this is midfoot, and this is forefoot. Clear? So tarso-metatarsal joint it separates the midfoot and forefoot. Okay. So talking about the joints, type of joint, it's a plain synovial joint formed by the distal row of tarsal bones. You know the tarsal bones? There are seven tarsal bones are there. Seven tarsal bones. This is one talus, calcaneum. This is sorry. This is talus, and this is calcaneum. This is navicular. Talus, calcaneum, navicular, cuboid. Clear? Cuboid, I'll give four number four, and 5, 6, 7. Medial cuneiform, intermediate cuneiform, and lateral cuneiform. Clear? So these are the tarsal bones. Again, I'll explain. One is talus. Two is calcaneum. Three is cuboid. Three is cuboid. Clear? And this is four. Four is navicular bone. Five medial cuneiform, intermediate cuneiform, and lateral cuneiform. Clear? So these are the seven tarsal bones. So this seven tarsal bones are arranged in three rows. One, two, three rows. Again, listen carefully. Seven tarsal bone are arranged in three rows. Clear? So what is first row? First row is formed by calcaneum bone and talus bone. This is first row, or it is otherwise called as a proximal row. Proximal row. Can you hear me?
Yes, sir.
Yes, sir.
And second जो row is formed by navicular. Second row is formed by the navicular bone. This is intermediate row. Intermediate row. This is second row. And third row is formed by all the three cuneiform and cuboid. Cuboid bone, medial cuneiform, intermediate cuneiform, lateral cuneiform. So this is called as distal row. I think you are clear. Seven tarsal bones are arranged in three rows. So this is first row, second row, and third row. So third row is, what is the third row? It is a distal row. So now what we are going to discuss is, our topic is tarso metatarsal joint. Tarso metatarsal joint is, where is the joint? Tarso metatarsal joint. So this is tarso metatarsal joint. This one we are going to discuss. Clear? So tarso metatarsal joint, this is metatarsal bone. Metatarsal first, second, third, fourth, and fifth. Clear? And this is the joint we are going to discuss. That is tarso metatarsal joint. So now tarso metatarsal joint is formed by what? Distal tarsal row and metacarpal bones. So this is the joint. Distal tarsal row with metacarpal bones. So what is distal tarsal row? Anyone? Bones of distal tarsal rows.
Sir, middle, medial, and lateral cuneiform bone and cuboid bone.
Cuboid bone. Cuboid, medial cuneiform, intermediate cuneiform, lateral cuneiform. So this is distal tarsal row. And what is the distal rows, that is metacarpal, one, 2, 3, 4, and 5 metacarpal bones. These two joints, or these four proximal bones and five distal bones, makes the joint, tarso-metatarsal joints. So how many joints are there? So how many bones are making five joints? I have told there are totally five joints are there. What? Tarso-metatarsal joints, there are five. There are five tarso-metatarsal joint. Where are those five? This is one, this is two, three, four, and five. So there are five tarso-metatarsal joints are there. So this four bones are making five joints. Again, I'll draw this diagram. I'll redraw. This is cuboid. This is navicular. Or I'll show the image here itself. One second. Clear? So this is cuboid. This is cuboid and lateral cuneiform, intermediate cuneiform, medial cuneiform. So there are four bones are there. Four more bones are making five joints. What are the five joints? This is one, two, three, four, and five. Clear? Five tarso metatarsal joints. So we are discussing this joint now. We are discussing this one. This is the joint we are studying now. Clear? Tarso metatarsal joint. Okay. It's a plain synovial joint formed by the distal row of tarsal bones. So this is what we discussed. There are four bones are there. And base of the metatarsal. Base of the, what are the base of the metatarsal? These are the base. Are you clear?
Yes, sir.
Yes,
And
sir.
now we will discuss about five metatarsal joints individually. First, first tarso metatarsal. First tarso metatarsal is composed of articulation between base of the base of the first metatarsal and medial cuneiform. First of this is medial cuneiform and this is base of the first metatarsal. Clear? So this is first metatarsal joint. And second is, now you see carefully, second metatarsal is formed by intermediate cuneiform and second base of second metatarsal. Clear? Here, this one. Now, if you see carefully, the second metatarsal is posteriorly shifted. It is slightly moved backward. Clear? You see the, I'll give other color. Mm, you see this joint, you see this joint, that is first metatarso, sorry, tarso metatarsal joint. This is first tarso metatarsal joint, and second is little bit back. You see third is also anterior. Can you follow what I am saying?
Yes, sir.
Yes, sir.
It is slightly posterior. Clear? Second tarso metatarsal joint is otherwise called as mortise. What is mortise? What do you mean by mortise? It's like a pagan socket. Pagan socket. Clear? In exact definition, a hole cut in a piece of wood to receive the end of another piece of wood. Clear? So that they are held together. That is called, that is a meaning for mortise. Clear? So it's like a mortise. So it is called as a mortise joint. Clear? Even ankle mortise. You might have heard ankle mortise. So the second tarso metatarsal joints is like a mortise. Clear? You see, I think you understand what I am saying. This is intermediate cuneiform and second metatarsal bone base. It forms second joint. This is first joint. So it articulates, if you carefully see the second base of second metatarsal, it articulates with base of the second metatarsal bone, it articulates with the intermediate cuneiform and lateral border of lateral cuneiform, sorry, medial border of lateral cuneiform and lateral border of medial cuneiform. So it makes a like this. Clear? This is medial cuneiform, this is intermediate cuneiform, this is lateral cuneiform. Are you getting what I am saying?
Yes, sir.
First metatarsal, first metatarsal bone, it articulates with only one cuneiform. But second metatarsal, it articulates with three cuneiform. Yes?
Yes, sir.
Second tarsometatarsal joint is composed of the articulation of base of second metatarsal with a mortise formed by three bones: middle cuneiform, and middle is intermediate. Middle is otherwise called as an intermediate cuneiform, and sides of medial and lateral cuneiform. So these three bones, it makes a mortise, and within this mortise, the second metacarpal bone, sorry, metatarsal bone, it articulates. So this joint is set more posteriorly than other tarso-metatarsal joint. That is what I have told. This joint is slightly posterior. This is slightly posterior. This joint is slightly posterior when compared to other. That is why the mobility of this joint is limited. Why? Because it is it is a mortise joint. It is fixed. This bone is fixed. It is more stable when compared to other tarso-metatarsal joint. The range of motion is limited in this second tarso-metatarsal joint. It is stronger and motion is restricted. Why? Because it is it is a mortise. It is well stabilized. Clear?
Yes, sir.
Yes, sir.
Now third metatarsal joint, it is formed by base of third metatarsal and lateral cuneiform. There are totally 5 joints are there. Clear? We have discussed first and second. First it articulates with base only 1 and 1. Second is articulating with 1 and 3. Third is articulating with 1 and 1. That is base of third metatarsal and lateral cuneiform. Clear? Third metatarsal, base of the third metatarsal and lateral cuneiform. Now coming to fourth. Base of the fourth and fifth. Now, fourth and fifth, it is having articulation with fourth, and fifth metatarsal base. It articulates with the cuboid bone. Cuboid. Are you clear?
Yes,
Yes,
sir.
sir.
So, it is both bones are, this is 2 in 1, 2 with 1. First is 1 and 1 with 1. Second is 1 with 3. And third is 1 with 1. And fourth is 2 with 1. First metacarpal articulate with medial cuneiform. Second metacarpal articulate with medial cuneiform, intermediate cuneiform, lateral cuneiform. Third metatarsal articulates with lateral cuneiform. Fourth and fifth metatarsal base articulates with cuboid bone. So there are totally 5 metatarsal joints. I think you are clear. Now, third and fourth and fifth. Okay. So there are 3 capsules are there. 5 joints and 3 capsule. Joint capsule, there are 3 separate joint capsules are there. Okay. I'll show in the diagram. First, now I am drawing the joint capsule. Na? First tarso metatarsal should have a separate joint capsule. It's a synovial joint. And a synovial joint, characteristics of synovial joint is it should have a joint capsule. Clear? So this first tarso metata TMT joint, it has separate capsule. And I'll give another color. Second TMT and third TMT, second and third TMT has separate capsule. And third, fourth and fifth TMT, it has separate capsule. So there are 3 capsules are there. They functionally they are separate. Not functionally separate, it is having a separate capsule. 5 joint is enclosed within 3 capsule, where the first tarso-metatarsal it has a separate capsule, second and third metatarsal has separate capsule, fourth and fifth has again a separate joint capsule. First tarso-metatarsal joint has its own capsule. Second and third joint shares common joint capsule. Fourth and fifth shares again a common joint capsule. Now coming to ligaments. So we discussed the joints. We discussed proximal and distal surfaces, and we discussed 3 joint capsules. Now coming to ligaments, there are 3 main ligaments are there. Among these 3 ligaments, deep transverse metatarsal ligament is considered as an important ligament. Why we will discuss later. Dorsal, dorsal means upper surface, and a dorsal surface. Plantar is lower surface, inferior surface, dorsal ligament, plantar ligament, and deep transverse metatarsal ligament. So deep transverse metatarsal ligament, I'll show in this diagram. So where is what is the function of ligament? Function of ligament is to stabilize the joint. Stabilize the joint. This is the main function of the ligaments. So what are the 3 ligaments? Dorsal ligament, plantar ligament, deep transverse metatarsal ligament. So where is this ligament? deep transverse metatarsal ligament. Where is it? It is here. This is called as deep transverse metatarsal ligament. So you may have question. We are studying about the tarsometatarsal joint and how this ligament will help in the stability of tarsometatarsal joint because it is far away. Answer is, imagine if this ligament is not present, what will happen? The distal ligament or distal uh, part or the head, this is called head. This is called head and this is called base of metatarsal. So what will happen if this ligament is not present? The head, all the heads will be separated. Suppose if this ligament is present, what will happen? All the heads will be stabilized or all the five metatarsal bones will be stabilized. If this ligament is absent, then it will have an effect in stabilizing the tarso metatarsal joint. So it indirectly deep tarso metatarsal ligament indirectly helps or augments the stability of tarso metatarsal joint. समझ में आया क्या?
Yes, sir.
And so this is about the ligaments, three ligaments. Deep transverse metatarsal ligament contributes to stability of proximally located tarsometatarsal joint by preventing excessive motion. Excessive motion of what? What?
Metatarsals.
Very good. It prevents excessive motion of metatarsal. If metatarsal bone is moving, then their stabilization will not be available proximally. So that is why this ligament is considered as important ligament of TMT joint. Now, next is axis and race. So we will study what is the concept of race. You know, for any motion you require axis. So we will study the axis and race. First we will study what is race. Ray is defined as a functional unit formed by metatarsal associated with cuneiform bone. Again you read this sentence. Ray means it is a functional unit. Ray is a functional unit. This functional unit is formed by metatarsal bone and associated cuneiform bone. So what does it mean? There are totally 5 rays are there. Out of 5 rays, I'll explain. 1 minute. There are totally 5 rays are there. What is ray? Ray is formed by, it's a functional unit formed by metatarsal bone and associated cuneiform bone. How many cuneiform are there? Medial, intermediate and lateral. and okay, I'll explain again. Cuneiform bone are included as part of movement units of tarso-metatarsal rays because of the small and relatively insignificant amount of motion occurring at the cuneo-navicular joint. Now this will be confusing. I will explain in the diagram. You have to listen carefully to understand. What I have told, there are first ray, second ray, third ray. Clear? So these three rays are formed by metatarsal bone, three metatarsal bone, and metatarsal bone and cuneiform bone. One second. Hmm. See, there are totally five rays are there. Clear? First through third rays, listen carefully. First through third rays associated with the cuneiform bone. So what is cuneiform bone? Here, one, two, and three. Three cuneiform bones are there. Clear? So this is first ray. I'll give another color. Hmm. This is first ray, this is second ray, and this is third rays. Clear? First ray, second ray, and third ray, it is formed by metatarsal bone and associated what? Cuneiform bone. Again, I'll repeat. First ray, second ray, and third rays are formed by metatarsal bones, all the three metatarsal bones, and associated cuneiform bone. But fourth and fifth ray, where is fourth and fifth ray? This is fourth and fifth. Fourth and fifth ray is formed by only metatarsal bone. Purv, can you repeat me? Repeat what I said.
Sir, first, second, and third ray is formed by metatarsal bone and associated with cuneiform bone, and fourth and fifth ray is only formed by metatarsal bone.
So here you may have doubt. Why here cuboid is not included? You may have query. Third, fourth ray and fifth ray should be associated with cuboid. But I told fourth and fifth ray is formed only by metatarsal. What is the reason? The reason is now you listen carefully. The reason is the what is this bone? Navicular. What is this bone? Talus. Am I right?
Yes, sir.
So this navicular bone movement, normally talus and navicular bone ka movement, it is a fixed bone. Movement is less. Movement is less in talus bone, that is talonavicular. What is this joint name? This joint is talonavicular. The talonavicular joint, the movement is restricted. Normally, talonavicular joint movement is restricted or limited. Limited. So, because of this, navicular sorry, one second. We are talking about this joint. What is this joint? Navicular and medial cuneiform, intermediate cuneiform, and lateral cuneiform. Clear? This joint is, movement is restricted. Movement is restricted. Not talonavicular. I am talking about navicular and three cuneiforms. So this joint is, movement is normally restricted or limited. So what happens? That is why it is, the three cuneiform is considered as a part of the ray. But now you listen carefully. This joint, what is this joint? Who can tell? Yes. What is these two joints? Who can tell? Come on. What is this joint called as? Very
Transverse
good.
tarsal joint.
Transverse tarsal joint. So transverse tarsal joint is an S-shaped joint like this. It is S-shaped joint. So it is made up of, transverse tarsal joint is made up of what? Who can tell? It is made up of which joint? What are the joints forming this? Yes. अरे बोलो, proximal bone and distal bone. What is it?
Sir, talonavicular and calcaneocuboid.
This one. Clear? Talus and navicular, calcaneum and cuboid. So this is the joint making transverse tarsal joints. And two joints make a transverse tarsal joints. What we are discussing, this is first ray, second ray, third ray. But fourth and fifth is formed only by metatarsal. When you talk 1, 2, 3, it is formed by metatarsal and cuneiform. Metatarsal and cuneiform. Third metatarsal and lateral cuneiform. But fourth and fifth ray is formed by only metatarsal. This is the point we are discussing. So now, The answer is when you take this joint. What is this joint? Yes?
Sir, calcaneocuboid.
Calcaneocuboid movement in calcaneocuboid is present. And there is a movement present in this joint. It is mobile joint. But listen carefully. What is this joint?
Talonavicular.
Talonavicular. In talonavicular, movement is restricted. In this joint, movement is permitted, and this joint it is restricted. So what will happen if this joint is restricted? Then these three cuneiform are fixed. When the talonavicular joint is motion is restricted, then the medial cuneiform, intermediate cuneiform, and lateral cuneiform are stabilized. That is why the metatarsal bone is, along with the cuneiform bone, it forms a ray. But in the lateral side, what happens? This bone is not fixed. Why? Because movement is present in this joint. Which joint? Calcaneum and cuboid में movement होता है, इसलिए वो ये जो क्यूबॉइड बोन स्टेबल नहीं है. If cuboid bone is not stabilized, clear, then it will not be a part of the ray. समझ में आया क्या? Got it?
Yes, sir.
So in if you want me to say in a single sentence, what I will say, cuboid is not stable. Why? Because calcaneocuboid joint में movement होता है, movement occurs. That is why what this cuboid bone is not stable. If cuboid and medial cuneiform, intermediate cuneiform, and lateral cuneiform are stable. This one, and this one, they are stable. That is why the ray consists of first ray, second ray, and third ray is associated with the cuneiform bone, while the fourth and fifth ray is not associated with cuboid bone. Are you clear?
Yes, sir.
So this portion is stabilized, well stabilized, while this portion is not stabilized. I think you are clear. Now you read this sentence. A ray is defined as a functional unit formed by metatarsal for first through third rays. I am talking 1 to 3 rays. Metatarsal and associated cuneiform bone, medial, intermediate, lateral. Cuneiform bones are included as a part of movement units of tarso-metatarsal rays. Why? Because small, relatively insignificant amount of motion occurs at cuneo-navicular joint. What is cuneo-navicular joint? Where is cuneo-navicular joint? This one. Cuneo-navicular joint. 1, 2 and 3. यहाँ पे joint motion is restricted or minimum. Why? Because I have told the stability is more in the medial side. So this joint movement is limited. So it is a part of the metatarsal. Fourth and fifth rays are formed by metatarsal bone because these metatarsals articulate with cuboid bone, but most motion at the tarso-metatarsal joint occurs. Clear? Okay. It is attached with the cuboid bone, but still it is not the part of the ray. Why? Because calcaneum bone and cuboid bone is mobile bone. Okay. Among these five rays, first ray and fifth ray, the range of motion is large. Clear? That is first metatarsal and fifth metatarsal bones में range of motion is high when compared to other rays. Second, third and fourth. Range of motion is limited in this joint. And the axis is oblique. You know, whenever the axis is oblique, the movement will be triplanar. तीनों प्लेन में मूवमेंट होता है इसमें क्योंकि एक्सिस ऑब्लिक है इसमें. Shall we discuss next class?
Yes, sir.
अभी तक समझ में आया?
Yes, sir.
Yes, sir.
Okay. So what? So what we discussed? We discussed the joint, other name for joint is Lisfranc joint. There are five tarso-metatarsal joints. Clear? And tarso-metatarsal joints, it separates the midfoot and forefoot. It's a plain synovial joint. First joint, second joint, first is made with a medial cuneiform. Second is made with medial, intermediate and lateral cuneiform. Third is made with a medial lateral cuneiform. Fourth and fifth metatarsal is made with the cuboid bone. Clear? Proximal bone and distal bone I am talking. It is having three separate joint capsule. And we discussed there are three ligaments. Dorsal ligaments, plantar ligaments and deep transverse metatarsal ligament. And we discussed rays. 5 rays are there. First ray, second ray and third ray are functionally associated with the cuneiform bone. Medial, intermediate and lateral cuneiform. But fourth and fifth ray, they are formed by only the metatarsal bones. They are not associated with the cuboid bone because cuboid bone is the mobile bone while the three cuneiform bone are not mobile or less mobile. So that is why the metacarpal first, second and third metacarpal is associated with the three cuneiform bone. First ray, second ray and third ray, they are formed by metacarpals and the cuneiform bones, while the fourth and fifth metatarsal is separate. The ray of fourth and fifth are separate. So next, rest we will study in the next class. Okay. Any doubts?
No, sir.
No, sir.